July 1st.
July 1st. Okay. Thank you.
All right, hello, Tom Hudson here. Final assessment here, full body assessment, head to toe, everything. We're going to do it all today. This is my wife Becky. She's my assistant for the day. This one's for the grade in my physical assessment nursing class for bachelor's program at Liberty University Online. So just to confirm, I have a consenting adult.
Yes.
I got my consenting adult. This is my wife Becky. So I always let my patient know, hi, my name's Tom. I'm going to be your nurse. I'm going to do a full body assessment here, physical assessment. I'm going to start with skin, tanned, symmetrical, intact, not seeing any areas of skin breakdown, deformity. It's well hydrated. Turgor is good. Skin snaps back elastic. No edema to these lower extremities. I see some macules, a couple of small papules on her face, a papule on her arm, a couple of small papules on the legs, scattered macules, freckles across the cheeks. As I said, no edema down here. Good turgor down here as well on lower extremities. As I'm headed, lean down. As I'm down here, I'm just going to go ahead and take a quick look at her fingernail or toenails. They're intact, they're smooth, no ridges, no splintering. They do not appear clubbed. Up here on her fingers, here again, no ridges, smooth, well intact. Cap refill, both intact, upper and lower. Each finger as I go through. And then I would have her bring her fingernails together. I'm checking the angle between them. I'm expecting it to be about 160 or greater. And all intact, good signs, no clubbing. I got skin, fingernails. Hair, it is treated, so it's dyed blonde. She's got some darkening in her roots here. Not seeing any damaged ends. Well connected to the scalp. Any pain when I do this?
No.
And the scalp moves freely on the skull, not feeling any crepitus. So, looking good there on the hair. Not seeing any damaged ends. Other than it just being a little bit wild today, but that's okay. So, on the rest of my ear, nose, and throat, I'm going to kind of go with my cranial nerves in the way I have them in place. I got a couple of things here for you to smell. Tell me what you smell there. I'm going to pinch off one side of your nose.
Coffee.
All right. And this one right here, I'm going to pinch off the other side.
Nutmeg.
Okay. And nutmeg. So now cranial nerve 1 taken care of. While I'm here at the nose, I'm just going to go ahead and take a quick peek inside, have her lift. Looking at the septum here, I can see the turbinates. They're pink. I do not see any deviation. I'm not seeing any perforation. I'm not seeing any foreign bodies. Well vasculated, the vasculature in there is good. Nice and red. So no problems there with the nose. I want you to pinch off one side of your nose, blow out there, and do it on the other side. Any problems breathing?
No.
Okay, awesome. So cranial nerve 1 taken care of. We would have started this, well, not started necessarily, but we would have done 2 tests for the eyes. Snellen's, the Snellen's chart, which is at 20 feet away from the chart. Start from the top, work our way down. The other one is 14 inches, and it's for your near vision, 14 inches. Ratings for the 20 measured in 20 feet and the different lines, so 20, 20 being perfect vision. With the nearsighted, the 14 inches, we're looking at 14. With the Snellen's chart, or both charts for that matter, we're going to do each eye separate, then both eyes, and do them both uncorrected and corrected. So, with the eyes here, Shine a little bright light. We would, of course, darken down the room, shine some bright light at each eye, look for our red reflex, and then we would check to make sure our pupils are equal, round, reactive to light. Then we would check our accommodation. I want you to pick a spot on that wall, and then look right here quickly, look to it, and follow it in. And we see the accommodation of the pupils as they shrink down as stuff comes closer. There's also we see the changes in the pupil over here. Even though this one's getting a bright light and going smaller, the opposite eye is shrinking a little bit as well. So, we got cranial nerves 1 and 2 taken care of. 3, 4, and 6, of course, I want my patient to open their jaw, move it side to side, okay, and close it, okay. I want her to open it against a little bit of resistance there, and go ahead, we do our facial gymnastics. So open, close, puff your cheeks, purse your lips, and tongue in cheek. Okay, no problems moving. Okay, so we check the strength of our masseter muscle, and there again, no pops, no clicks. And then we went ahead and continued checking the rest of the cranial nerves there that deal with the jaw with the facial gymnastics. Continuing on with our eyes, I'm sorry, these are 5 and 7. Going back up here, we're going to do 3, 4, and 6. It got them mixed up. So I'm going to have my patient cover one eye, and I want her to tell me when she sees this.
See it?
Okay.
See it?
Okay.
See it?
Okay. Same eye. Don't look towards it. Look towards me.
See it?
Okay. Coming up.
See it?
Okay. Coming down.
See it?
Okay. And then we would do this, of course, with this eye.
See it?
Okay.
See it? See it?
Okay. And.
See it?
Okay.
See it?
Okay.
See it?
Okay. So they're checking her peripheral vision, and then we need to check her 6 cardinal fields. Just follow. And good eye movement there with no nystagmus.